Namaste. Welcome you all for the yoga session. In this session, we are going to use a mat and a blanket. We shall focus on some movements of the hips, especially the flexion, extension, and abduction and adduction, with some trunk movements so that the lumbo-pelvic hip complex gets a good movement. We shall begin with some basic postures. Lie on your back, fold both the legs, heel closer to the hips, foot 6 inches apart, foot parallel to one another. Feel your breathing. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. Feel also the posterior region, the lower back, that also responds to the breathing. Watch your breathing. Chest should be reasonably stable, neutral. Watch the movement of the diaphragm. As we inhale, allow the abdominal cavity to expand throughout, all around, circumferential expansion of the abdominal and the pelvic cavity. As we exhale, it should contract. Towards the end of exhalation, try to contract the abdominal muscles little more than normal. This is a very fundamental breathing which has to be implemented throughout in all the postures. This breathing not only helps the abdominal muscles but also helps the mind to calm. Stretch both arms up. Breathe consciously. Neck at the center, chin towards the chest. Raise your right leg up. Stretch the heel. Pull the kneecap. Toes towards the knee. Pull the kneecap. Tighten the quadriceps, the front of the thigh. Feel the stretch at the back of the thigh. Watch your hip. Watch the gluteal muscles or the muscles of the hip. Watch your back muscles. Press the left foot. For that you got to activate the calf muscle. Also contract the hamstring muscles against the calf muscle and feel the knee capsule, that is the outer covering of the knee on your left leg. Fold right leg down, left leg up, pull the kneecap, stretch the heel. Consciously watch the muscles of the leg, especially the calf muscle, hamstring, then the muscles of the hip and also the lower back. Do not miss out on your breathing. Breathe at ease. Down, right leg up. When raising the legs, also ensure that the base of the spine does not take off the floor. Pull the kneecap, stretch the heel, the muscles of the leg, especially the hamstring, they help the back a great deal. Right leg down, chain, left leg. Pull the kneecap, stretch the heel, The hamstring muscles are connected to the hip bone, and on the hip bone sits the spinal column. So they are all involved in a kinetic or kinematic chain. The health of the hamstring is very crucial. So see the stretch. Relax the left leg. Right leg up. Hold the right knee from both hands and pull the knee closer to the chest. And keep the foot, knee and the hip in the same plane. That is, do not move the knee out of the plane. And on both the legs, squeeze the hamstring muscles against the calf muscle and feel the inner corners of the knee. Also feel the outer covering of the knee capsule. Watch your breathing. Release right leg. Left leg up. Hold the knee, press the knee closer to the chest. This particular posture does help the gluteal minimus and the gluteal medius muscles. These are the two muscles in the region of the hip that greatly helps in all our walking. Pay attention to the breathing. That is the key. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Release left leg. Right leg up. Hold the knee, press the knee closer to the chest. Stretch the heel, right heel, that is toes towards the knee. Do not neglect the left leg. You should press the left foot. For that you have to activate the calf muscle, then contract the back of the left thigh. Watch also the posterior skin, the thick skin resting on the floor. Release right leg. Chain. Left leg up. Hold the knee. Press the knee closer to the chest. The posterior thick skin on your lower back, the thoracolumbar fascia as it is called, that also responds to breathing. Just watch that. It also experiences a mild stretch as you inhale and a contraction as you exhale. Get connected with the posture, get connected with the breathing, be present. Release left leg. Right leg up. Fold the knee from left hand, hold the ankle joint, pull it closer to the root of the left thigh. From right hand, push the knee. On both the legs, contract the hamstring muscles, the back of the thigh against the calf muscle to enhance the feeling of the knee capsule. As you inhale, sensitize the base of the spine. Feel the base of the spine, especially the sacroiliac joint. That is the articulation between the iliac bone and the sacrum of the spine. Release right leg. Change. Left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh. From left hand, push the knee. It's very important to have complete postural awareness. Do not allow the pelvis to rotate. Release left leg. One more time. Right leg up. Fold from left hand, hold the ankle joint, pull the heel closer to the root of the thigh. From right hand, push the knee. Activate the back of the thigh on both the legs. Breathe consciously. Feel the base of the spine. All these postures are designed to help the core muscles, which would include the region of the abdomen, the lower back, the hip, the pelvis, because this is the region which takes a lot of loading, and these postures prepare one to safely practice other postures. Release right leg. Chain left leg. Fold from right hand, hold the ankle joint, pull the heel closer to the root of the thigh. From left hand, push the knee. This posture also obviously helps the knee joint, the hip socket also gets a good soothing movement. The sacroiliac joint experiences a mild but very necessary movement. Good breathing is the foundation for all these postures. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it from right hand, push the knee across the chest. This is a very good stretch for the gluteal maximus muscle, which is one of the major muscles located in the region of the hip. Again, watch your breathing. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Release right leg. Left leg up. Fold from right hand, hold the ankle joint. Pull from left hand, push the knee across the chest. Press it closer to the trunk. Now here the abdominal muscles and organs also stand to benefit because of enhanced massaging movement under the pressure of the thigh. Do not neglect the right leg. Press the right foot. Tighten the calf muscle. Tighten the back of the thigh. Release left leg. One more time. Right leg up. Fold from left hand, hold the ankle joint. Pull from right hand, push the knee across the chest. Feel also the lower back. No muscle acts in isolation. They're all connected in a great kinematic linkage. So that is why all these varied movements are essential to keep this whole chain of movements healthy. Release right leg, chain, left leg up, fold, from right hand hold the ankle joint, pull, from left hand push the knee across the chest. You must do these postures with awareness. Mechanical movements does not yield great results. The movement should be done with awareness. You must be present. You must get completely involved. Release left leg. Watch your breathing. Right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the right heel. Now lift the left foot, keeping the heel on the ground, then slowly sliding the heel, straighten the left leg. Pull the kneecap. Push the knee as close to the ground as possible, while you draw the right knee as close to the chest as possible. So right hip is going towards a strong flexion, while the left hip is going to a neutral position. In effect, this is a very good movement for the back muscles. Slowly fold your left leg, taking the heel closer to the hip. Release right leg. Chain, left leg up, fold, hold the knee, press the knee closer to the chest. You must completely pull the knee. Keep the left heel active, toes toward the knee. Then slowly slide the right foot, keep the heel in contact and gently slide, straightening the right leg. Right heel also have to straighten, toes towards the knee, pull the kneecap, charge the thigh as close to the ground as possible. Feel the region of the tailbone. Breathe well. All these movements are very useful, especially in the beginning. Slowly fold your right leg, release left leg. Right leg up, fold, hold the knee, press the knee towards the chest. It's also important to repeat these postures. Then slowly slide your left leg forward, straightening the left leg. When you do that, ensure that you maintain the line and length of the left leg. That is, you should not deviate the axis of the left leg. Watch your breathing. Feel the hips, feel the thigh, feel the lower back. Slowly fold left leg, taking the heel closer to the hip, then release right leg. Chain, left leg up, fold, hold the knee, press the knee closer to the chest, stretch the heel, gently slide the right foot, keep the heel in contact with the ground, raise the foot, then stretch right leg. Pull the kneecap. Feel the pelvic cavity also as we inhale and exhale. So these movements prepare the core muscles for further action so that they become very safe to practice. Slowly flex the right leg, then release left leg. Be attentive. Right leg up, fold, rest the right ankle just below the left knee, rise the left leg from both the hands, clasp the left thigh, pull closer to the chest. Also move the right knee slightly away from the trunk. Feel the region of the hip. You must feel the deeper muscles in the hip. Keep both the heels active. Slowly bring the left foot down. Take the right leg down. Chain, left leg up, fold, keep the ankle slightly below the knee, rise the right leg, clasp the thigh from both hands and pull closer to the trunk. Both the heels active, toes towards the knee, which means the calf muscle gets a good stretch. Do not lose track of the breath. Release right leg, release right leg, left leg also down. One more time. Right leg up, fold, ankle joint just below the left knee, stretch the heel, rise the left thigh. Now from left hand hold the left thigh, pull from right hand to push the right knee. Now you can feel enhanced stretch deep in your right hip. You are stretching one of the important muscles, the piriformis muscle, the deeper muscle in the hip, which happens to be very close to the sciatic nerve. Release the legs, right leg also down. Chain, left leg up, fold, ankle just below the knee, rise your right leg with knee flexed, from right hand pull the right thigh, from left hand push the left knee. Keep the heels active. So all these postures rejuvenate the muscles in and around the lower back, hip, pelvis. The hip joint also gets a very rejuvenating movement. Knee and ankle also become active. Release the right leg, left leg also down. These set of movements help one to prepare in a safe way for doing other postures. Rise both legs up, hold the knee, press the knee gently towards the chest. Breathe well. Even here, stretch the heel and tighten the hamstrings against the calf muscle. You must make the posture as effective as possible. Also watch your breathing. Watch the posterior region, that is the thick skin resting on the mat, especially the lower back and the lower part of the upper back. That's where the thick skin, the thoracolumbar fascia, is spread. Just watch. And tightening the hamstrings helps the knee capsule a great deal. Stretching the heel helps your ankle joint, the arch of the foot, the intricate muscles, ligaments and joints in the foot also. Do not neglect the muscles of the forearm and upper arms. That also you should actively engage. And of course, you've got to breathe consciously. So when you do all this, your mind cannot oscillate. It will be in the posture. That is when the posture becomes a yogasana. Release the legs. Feel the breathing. Stretch your left leg forward. Roll onto the right side. Press the left palm. Slowly get up. So these are some of the basic postures that greatly helps one to relax the most taxed portion of our system. Sit upright on your heel. Keep a blanket below the knee. Take the all fours position. Middle finger pointing forward, palms below the shoulders, knees slightly apart, trunk nearly parallel to the ground. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Take your right leg forward, right foot between the palms, flex the knee, press the palm, look forward, chest and navel up. Keep the left leg also active. Stretch the toes pointing back. Squeeze the calf muscle. Watch your hips. Right hip in flexion, left hip in extension. So watch the base of the spine. Take your right leg back, chain. left leg forward, left foot between the palms, flex the left knee, feel the base of the spine, the differential movement of the hip helps the pelvis, the lower back, as well as the hip girdle, left leg back. Breathe at ease in the all fours position, Chatushpadasana. Right leg forward, press the heel on the blanket, press the palm, chest and navel up, look up. Heel just by the side of the left knee, look up and tighten the hamstrings and the calf muscle. And look up, breathe at ease, take right leg back, chain, left leg forward, heel on the blanket, knee is flexed, hip is flexed, look up, feel the gluteal region. These are simple movements to get the muscles of the lumbopelvic hip complex into action. Left leg back. Come back, sit on your heel, sit upright. Watch your breathing. Sit in the all fours position. Middle finger pointing forward. Take right leg forward, flex. Knee should come between the palms. You are flexing the knee, flexing the hip, keeping the palm pressed, chest and navel up. Try to take the right hip as close to the ground as possible. If it can be seated on the mat, that is good. But keep your left leg active. Stretch the toes, squeeze the calf muscle. The right thigh and left thigh should be parallel. So to position the right thigh, in such a way that the right and left thigh run parallel to each other, so that the chest and knee point forward. Breathe well. Feel the gluteal region. right leg back, chain, left leg forward, bend the left leg, keeping the palm pressed, try to rest the left hip on the mat, knee between the palms, right leg straight. Now open the chest, look forward, watch your hip girdle, the pelvis and the abdomen. Orient the chest so that it points to the forward direction. The left thigh also oriented in the forward direction. Feel the spinal column, feel the gluteal muscles. Slowly take the left leg back. Come back and sit on your heel. Hip is a very powerful and one of the highly loaded joints in our body, and the hip has implications on the back as well as the legs. Sit in all fours, middle finger pointing forward, trunk nearly parallel. Now gently move the right hip to right side, keeping the arm straight. It is as if you are pushing the right hip to the right side. You are inclining the thighs. Feel the deep inside the hip. Feel the lateral muscles of the thigh. You have to keep the arm straight. So in essence, the shoulder girdle is fixed, hip girdle is swayed to the side. Watch the stretch deep in the hip. And breathe well. Slowly come to the center. Keep both arms straight. Press the palm. Now move the pelvic girdle sideways. Both the hips you should move it to the left side. Particularly feel deep inside your left hip. Keep the palm pressed. Feel the lateral muscles of the thigh. Feel your knee joints. Watch your breathing. Slowly come to the center. Come back, sit on your heel. So all these stretches are good for the gluteal muscles, gluteal minimus, medius and the maximus, plus these movements also involve the deeper muscles in the hip, like the piriformis muscle. Sit in all fours, middle finger pointing forward, trunk nearly parallel. Right leg forward and then stretch diagonally. Press the palm, pull the kneecap. Stretch the right leg towards your left side, between the legs and the arms. Keep it straight. Trunk nearly parallel to the ground. This is the adduction of the hip. So feel the gluteal maximus muscle. That is also getting a good stretch. The legs also get a good stretch. Fold right leg, take it back. Then change. Left leg, bring it forward. Then stretch to your right side diagonally between the two arms and the right knee, underneath the trunk, but keep the legs straight. Feel the base of the hip. Breathe well. We make a number of types of movements in our day-to-day life, and these stretches help to trigger the kinematic chain that is required for a variety of movements. Slowly come back, then sit on your heel. Watch your breathing. Come to all fours. Most of the movements we are doing from this base position of the all fours are Chatushpadasana. Take your right leg and take it below the trunk. Right knee at 90 degrees, stretch the heel, press the palm and push the hip down, but bend back, look forward. Tighten the right hamstring, right heel stretched. Watch your left leg. Left foot stretched with the inner edge on the mat. So you can see that the right hip is in adduction. Right knee is flexed. Slowly rise up, take the right leg back, then change. Take left leg forward, flex the knee at 90 degrees, stretch your right leg. Left thigh should be perpendicular to the right thigh, and right leg parallel to the left leg. So that's the way to keep the folded leg. But both legs stretch the heel, feel the breath, keep the palm pressed, arms straight, look forward. Press the palms, slowly come up, left leg back, one more time, right leg forward, right knee flexed at 90 degrees, left leg straight, then gently bend the trunk forward. You can feel a better intensity of stretch deep in the hip, especially the right hip. Note the position of the right thigh perpendicular to the left thigh. Right lower leg parallel to the left leg. Keep the right heel active, left heel also active. Slowly come up. Take your right leg back into the all fours. Chain. Take your left leg forward, flex the knee, take it underneath the trunk, keep the left hip on the mat, then gently flex the elbow, bend the trunk forward. Charge your right leg, stretch the right heel, pull the kneecap. Left knee bent at 90 degrees. Note the orientations. Watch the base of the spine. The spine also experiences a nice twist. Use the breath to further activate the pelvic muscles. Slowly come up, take your left leg back. Sit on your heel. Sit upright. The spinal column, the basis for our trunk, actually sits on the hip girdle. So there are two close neighbors, the hip and the back. Sit in all fours. Breathe at ease. Now flex the right leg at 90 degrees. Move it to right side. So right thigh perpendicular to the left thigh, leg parallel to the left leg, then press the palm, rise the trunk up as if you are doing Bhujanga. Left hip in extension. Left knee is extension, right knee is inflection. Activate the right heel, take it to dorsiflexion. Left foot is in plantar flexion. Slowly come up, right leg back, then chain. Left leg flexed and kept placed on the floor, bent at 90 degrees, press the palm, inhale, exhale, rise the trunk and navel up. Left thigh perpendicular to the right thigh. Left lower leg parallel to the right leg. Watch the root of the left thigh. Watch that region of inguinal ligament. Watch your pelvis. Watch the hips. Watch the back. But keep both legs active. You have to tighten the left hamstrings, back of the thigh, and stretch the left hip. Toes pointing towards the knee. Slowly come up. Left leg back. All fours position. One more time. Lie down, then flex the right knee at 90 degrees. Take your left hand down below. Catch the right thigh. Then right hand up and back towards the floor. And watch your trunk. Watch your upper back, shoulders, lower back. Watch the hips. Breathe well. It's a nice twist for the complete trunk. It also helps the arms. From left hand you have to catch the right thigh. Now take your right hand back. Press the palms in position. Slowly come back to all fours. Chain. Left leg bent at 90 degrees and line your chest. Take your right hand down below, catch the left thigh, rise your left hand up and move the left hand. To the other side, left hand straight. Keep your right leg straight. Feel the abdominal region, chest, the pelvis. Feel the complete spinal column. Slowly bring the left hand back. Press the palm. Slowly come back to all fours. Sit on your heel. Sit upright. Just watch your breathing. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Trunk and navel up. Just pay attention to your breathing. Be present. It's important to keep the mind in the present. Palms facing upward, tip of the thumb and index finger in contact. Relax your tongue, nose, throat and the jaws. Breathing should become slow, steady, very calm, no jerkiness. You're completely relaxed, and in this session we have done a good stretch for the muscles of the hips in particular, and of course for the complete lumbar, pelvic and hip complex in general. Namaste.